How to remove deep ingrown hairs. If you have an inflamed, itchy spot on your skin right after shaving, you might have an ingrown hair. Ingrown hairs are caused by hair curling up and growing back or sideways into your skin. Deep ingrown hairs can sometimes stick around for weeks or months, and they can cause a lot of pain and irritation. If you're dealing with a deep ingrown hair, read through this article to see how you can remove it at home and when you might need a doctor's help. Method 1. At home. Number 1. Wash the area with a washcloth. If you're going to try to remove the ingrown hair, use a wet washcloth or a soft bristled toothbrush to gently scrub the area with soap and water. Go slowly, and rub in a circular motion to free up the hair and loosen the skin. You don't need to exfoliate, since that could cause more irritation. Try to do this for several minutes to gently loosen the ingrown hair and make it easier to remove. Number 2. Use a needle to gently lift the hair out of the skin. Sterilize a small needle by dipping it into rubbing alcohol and letting it air dry. If you can see the small loop of hair sticking out of your skin, use the needle to gently pry the hair upwards. Go slowly, and use a warm washcloth to keep your pores open. The goal is to get the hair out of your skin so it can grow properly. If you can pull the hair out enough that you get it out from underneath your skin, that's great. Your ingrown hair is solved, and you don't need to do anything else. If you can't see the small loop of hair, just leave the ingrown hair alone. Over time, the hair may rise to the surface, and you can try to lift it out with a needle. Number 3. Avoid shaving, tweezing, or waxing the area. Ingrown hairs can get worse if you continue to shave or remove your hair. If you want to let the ingrown hair work out on its own, try leaving the area alone. In some cases, even deep ingrown hairs will work themselves out in 1 to 6 months. When you first notice an ingrown hair, try just leaving it alone for a while to see if it works itself out. After a few weeks or months, you can move on to trying to remove it yourself at home. Number 4. Avoid picking at or scratching the ingrown hair. Although it might be tempting to pop or burst your ingrown hair, doing so can actually make it worse. Plus, opening up the skin like that can leave you vulnerable to bacteria, which can lead to an infection. When in doubt, leave your ingrown hair alone. Method 2. Medical treatment. Number 1. See a doctor if your ingrown hairs are chronic or infected. Most of the time, ingrown hairs aren't a cause for alarm. If you have multiple ingrown hairs a month or you think your ingrown hair is infected, it's time to make an appointment with your doctor. Signs of infection include pain, swelling, hot skin, and fever. Number 2. Use a retinoid prescribed by your doctor. Retinoid creams can help remove dead skin cells from your skin, which can unclog your pores and release ingrown hairs. If your ingrown hair is causing continuous irritation, head to the doctor and ask about a retinoid cream like tretinoin. Your doctor can tell you how often to apply it and how much cream to use. Retinoid creams are prescription only, so you'll have to get one from your doctor. Number 3. Apply a steroid cream to reduce inflammation. Ingrown hairs can sometimes swell up and get uncomfortable. If your skin is red or inflamed, head to the doctor and ask about a steroid cream to soothe your skin. You can usually use a steroid cream once a day to reduce swelling and inflammation. This is a great option if your ingrown hair is painful or causes you discomfort. Number 4. Use an antibiotic cream to treat or prevent infections. Deep ingrown hairs that stick around for a while can sometimes get infected. Your doctor may prescribe an antibiotic cream to reduce the chance of an infection, especially if the skin is broken. If your ingrown hair is already infected, you may need to take oral antibiotics. Signs of an infection include swelling, itching, redness, irritation, and warmth. If you think your ingrown hair is infected, make an appointment with your doctor right away. Method 3, Prevention. Number 1. Exfoliate your skin before you shave. Dead skin cells can clog your razor and lead to more irritation, which can cause ingrown hairs. Before you shave, use a chemical or physical exfoliation all over the area to prep your skin. Use a washcloth and warm water to gently scrub your skin in slow, circular motions to prevent any irritation. Chemical exfoliants are great for sensitive areas, like your face or bikini line. Physical exfoliants work better on tougher skin, like your legs or arms. Number 2. Use a brand new razor. Dull razors tend to pull or tug on the skin, which can cause ingrown hairs. Before you shave, load your shaving razor with a new blade, or clean off your old one well if it's not disposable. If you're using an electric razor, add a number 1 shave guard to avoid shaving too close to the skin. If you're using a disposable razor, try to change the blade every 5 to 7 shaves, or more if you're prone to ingrown hairs. If you're using an electric razor, clean the blade every 3 to 4 shaves. Number 3. Soak your skin in warm water before shaving. Warm water opens up your pores and reduces the chance of ingrown hairs. You can either take a warm shower before you shave, or you can soak a washcloth in warm water and then press it against your skin for a few minutes. Number 4. Shave in the direction your hair grows. Going against the grain can cause the hair to grow backwards into the skin, causing ingrown hairs. Instead, point your razor in the direction your hair grows, and try to stick to that direction the entire time. Your shave will be much smoother, and your skin will thank you. You might not get quite as close of a shave this way, but you'll be much less likely to get razor bumps or ingrown hairs. Number 5. Consider laser treatment as a last resort. If you're prone to ingrown hairs, shaving, waxing, and tweezing might not be great options for you. Instead, consider laser hair removal, a process that uses lasers to penetrate deep into the hair follicle and inhibits regrowth. 13 Laser hair removal can last for months or even years, and the hair that grows back usually isn't as thick as it was before. Keep in mind, though, that laser hair removal usually isn't covered by insurance since it's considered a cosmetic procedure. Depending on the area you get done, laser hair removal can cause blisters or darkening of the skin. Usually, laser hair removal is $350 to $400 per session. If your hair is very thick or you're lasering a large area, you may need multiple sessions. Bear in mind that laser hair removal only works on dark hair with white, blonde, or gray hair. There's no target for the laser energy. Electrolysis is a better solution for people with lighter hair. Thanks for watching.